Welcome to Chapter 16 of Intro to Psychology. In this video, I'm just going to briefly describe some options for Wayne State University students who are seeking psychotherapy. So if you feel like you are having any kind of a mental health struggle, or you feel like you might be experiencing just some emotional difficulties, or might just need some advice or some counseling or some help working through a difficult situation, it's important to know about the different mental health services that are available to you as a registered student here at Wayne State University. So probably the first line of the first option, the first main option for registered students is CAPS. So the Counseling and Psychological Services, which is located in the Student Center. And during the pandemic, they are also doing virtual psychotherapy via Microsoft Teams. They offer individual psychotherapy as well as group psychotherapy, as well as some great mental health workshops, things like how to uh, uh, manage stress during exam season, or how to navigate through breakups in university, and many other common issues that are common among university students. Next is the Mental Health and Wellness Clinic in the College of Education, which is recently started in the fall of 2019, in the winter of 2020, I think. And they offer a broad variety of psychotherapy opportunities, as well as career and vocational assessments. So if you're looking for career guidance, looking for an assessment of what your strengths and weaknesses are, and how that can inform your career, that's a great place to go. They also offer art therapy, which is a very interesting application. And that clinic is run by the College of Education. They have many students in school psychology, as well as counseling psychology, graduate students who serve as psychotherapy trainees in that clinic. And lastly, there's the Wayne State University Psychology Clinic, which is my clinic, which is operated by the Department of Psychology. What makes us different than the other clinics is that we have a heavy emphasis on psychological assessments. So if you're looking just not for therapy just yet, but to get an assessment of your mental health or an assessment of your cognitive abilities, if you feel like you might benefit from some kind of academic accommodations, or if you feel like you might have gone undiagnosed with something like dyslexia or ADHD or any other learning problem, we can do a psychodiagnostic assessment that plays out probably over the course of several weeks to assess your cognitive and emotional and behavioral functioning, and provide some recommendations. And one of those recommendations might be to do psychotherapy. And we have students in the PhD clinical psychology program who conduct psychotherapy, as well as a group psychotherapy. We have a specialty clinic for individuals with borderline personality disorder, and provide a host of other services to not only university students, but as well as individuals from the community. Those websites are also listed here in the slides, CAPS, as well as the contact information, the Mental Health and Wellness Clinic, and the Wayne State University Psychology Clinic. All of these located on the campus of Wayne State University within close proximity to each other. The Mental Health and Wellness Clinic is located in the College of Education building, just next to the Student Center building. And then the Psychology Clinic is located in the Rands building facing Cass Avenue. And the last thing I'll say on this topic is knowing what kind of therapist you might benefit from seeing. So if you are interested in getting a psychodiagnostic assessment, if you don't know, if you feel like something's wrong or something's problematic, or you might fit in some kind of diagnostic criteria, then you probably are looking for some kind of assessment, some kind of psychological assessment. And those are largely done by psychologists. So people who have a PhD in psychology or a doctor of philosophy in psychology. So I'm training to receive a a PhD in psychology, specifically in clinical psychology, so that I can do assessment and therapy. Other individuals who also do limited assessments as well as psychotherapy are clinical social workers. So you can look for these acronyms or these credentials. Probably most common is the licensed clinical social worker. the vast majority of therapists are actually clinical social workers. There are many more clinical social workers than even registered psychologists. And you might also look for other terms that we often throw around: counselors, clinicians, therapists. The word therapist can be applied broadly to anyone who provides therapy, most commonly people who have a master's degree. They might be a licensed professional counselor, a marriage and family therapist, or a drug abuse counselor. And so these individuals, clinical social workers and counselors and therapists, typically have a master's level training, whereas psychologists have a more research focused or doctoral level of training. Also, it's good to know other therapists or other health providers who prescribe and monitor medication. So these are individuals who may provide psychotherapy, but also have the ability to prescribe medication. Psychologists, social workers, other counselors, typically in most states, do not prescribe medication. So primary care physicians can prescribe medication for psychological problems, such as Adderall for ADHD or certain antidepressants. They may also refer you to a psychiatrist, who is someone who's been through medical training, an MD or a DO program, and then has gotten residency training specifically in psychiatric illness and prescribing medication for certain illnesses. There may be a tendency for some psychiatrists to rely on medication. There are other psychiatrists who rely primarily on psychotherapy. And there are probably many more who do a combination of psychotherapy and using biomedical treatments. Then there are other mental health professionals, such as psychiatric nurse practitioners or family nurse practitioners or psychiatric pharmacists, who also have prescription privileges and can help with certain mental health problems. And so it's important to know the different trainings and the different experiences that these individuals might go through to know who might be the best type of mental health professional to help you with your situation.